I work with Instituto RIA. We're an organization in Mexico that does research and advocacy on drug policy reform broadly, not just focused on tobacco harm reduction, but we work with people who use drugs, primarily illegal drugs, but also obviously working to reduce the risks and harms of tobacco and of alcohol. And so we're pleased to be here today to present some of the work that we've been doing on this issue. So the panorama in Mexico is that in February 2020, there was a presidential decree by President Andrés Manuel López Obrador that prohibited the importation of vaporizers and any sort of electronic device related to tobacco or nicotine consumption. This was a direct response to the United States EVALI crisis, which obviously we know had little to do with the legal market of tobacco and nicotine devices, and much more to do with the illegal market of vaporizers, which had been had the additive of vitamin E, and which then caused this health crisis. It's also just important to say here in Mexico, and maybe because of our closeness to the United States, we tend to use illegal market instead of black market to not create some sort of good, bad connotations based on that can have racial undertones. So in July 2021, they lifted the prohibition on importing heated tobacco vapes, but that didn't last very long. Since electronic cigarettes were already illegal since May 2008 with the general law for tobacco control. This is something that has continued to be a tension between the courts and between the federal government. The federal government will do a decree, and then a court will have to bring down that decree, and then they'll do another one. So it's just an ongoing whack-a-mole case. In 2016, 2017, which are the last data that we have, nationwide prevalence data, 1.5 million people said that they had vaped. 15 million people said that they smoked traditional cigarettes. So we definitely have a lot of work to do towards providing harm reduction to people who smoke cigarettes. And this is something where it's also definitely an economic resources issue and a social justice issue. We had a legal case in November 2020, which allowed a certain company to still sell their tobacco heating devices on a national level. So again, this is something that creates exceptions to companies that have large legal teams that can go against any of these presidential decrees. So in this past year, in May, there were reforms to the general tobacco law. April, May, it had passed through the legislative processes, and it prohibits any smoke, any vaporizing in any public places, and including restaurants that have terraces. And so it said, if you want to allow people to use tobacco or nicotine products, they have to be given their own separate space where no beverages or food can be served, and you need to ensure that it all stays in that space and that can't come out anywhere. So really, they're just like, make a little box where everyone would go to be able to consume and make it as unfriendly as possible. This also made it illegal to smoke in public places that are widely con gran concurrencia, that have a confluence of people. But it doesn't say, if there's 100 people, it's too many. If there's 50, it just says when there's many people together. So really, it's very subjective when someone would be able to consume, particularly if you think about just like on the street. If there's many people, then you wouldn't be able to. But if I'm alone on the street, then it would be okay. There was also prohibitions that were made on publicity and where cigarettes could be placed in stores, similar to the previous previous presentation where she said, cigarettes are locked behind. That's the point. The idea would be that you wouldn't be able to see the cigarettes at any point. Some of these changes, we thought this can be positive. But, with the more positive changes, certain chains of convenience stores sued and they won. And so they couldn't really put into place many of these restrictions. And at the end of the day, these sorts of reforms to the general tobacco law, what they do is they put the pressure on small business owners to create these spaces, which they're not going to do. And so then it's just fomenting that people will probably break the law. because the reality is that there are online sales, that there are unregulated sales, that people sell cigarettes, just one cigarette at a time. There are regular substances that are put into these devices and into cigarettes, and it's always difficult to assure quality controls. So when somebody is very committed to vaping, the most likely scenario is that they might go to the United States or another country in order to buy in a legal market and then bring it to Mexico, which then, of course, creates this inequality. The Supreme Court, I had talked about this, that they upheld the prohibition on commercializing products, but they did say that they should be allowed to use, that people should be allowed to use e-cigarettes and other devices for tobacco. Since obviously we also work on the issue of cannabis, these are very intricately connected. From the Ministry of Health, or the Health Secretary, there is a huge denial that there are fewer risks from non-combustion devices. They refuse to look at the evidence that vaping could be a harm reduction mechanism, even as they implement other measures that are harm reducing around other substances. So they really, we have presented them with the cases of New Zealand, with the cases of the UK, and they just really are on a very either you smoke cigarettes and die, or you quit. And those are the two options that they are willing to give to people. And they are unwilling to look at really what is the broad spectrum of options that could be available to people who use tobacco and nicotine. So from Instituto RIA, we undertook over the last year, and we're still finishing, and it should be published in the next 2 months, a research project on the current status of the market. This really hasn't been done much. I mean, we have a colleague, Roberto Sussman, who works a lot on vaping and really bringing forward how users are perceiving, but we haven't had a lot of research done. So this research project looks at mapping users' perceptions of risk and their relationship to vaping, as well as vendors and how they have related to the state, non-state actors, including organized criminal groups, and their views on regulation. The objectives of this was really to base our work in risk and harm reduction, to understand the illegal nicotine market, the composition of the products that are sold, and explore what regulation should look like in Mexico. It's important to note that all political parties at different moments have presented laws and legislative proposals, but nothing has moved forward. We also created a laboratory analysis of the composition of the devices bought in the illegal market in Mexico. So I'm going to speak a little bit about this research project. There are 5 sections. It's really about understanding and analyzing the legal and social context of e-cigarettes and vapes in Mexico, applying surveys to explore the reality of people who use these devices, to understand their preferences, expectations, and positions, particularly regarding prohibition and what they feel are the health impacts of using either these devices or using tobacco. To understand the illegal market primarily in Mexico City, since we were unable to really do this outside of the city, undertake laboratory analysis to understand what's in these devices, and then draft documents that can compile this information for different audiences, primarily the media, people who use these products, and legislators or authorities. So we came out with, we did this outreach to people who have a smoke shop that maybe sells nicotine products or commercialized vapes, to answer a short questionnaire, a short survey, or people who vape or use electronic cigarettes as a means of really being able to understand what is it that they think. So we did this over the last year, and now we've been analyzing this data. Now, what we really came up against, which I think is important to note, is that a big part of it was buying these vape devices and then finding a laboratory that would be willing to analyze them. So we contacted the more than 12 laboratories here in Mexico that are certified by our regulatory body, COFEPRIS, and asked them if they would be willing to, obviously being paid, to do this work. There was not a single laboratory in Mexico that was willing to do this research for many reasons. Some of them said they didn't have the proper techniques, even though we know that this is not true because we know that these studies have been done before. But It has never been done before in a political environment where the president is so against vaping that then a laboratory is concerned that if they undertake this study, they could have their licenses removed. That's the truth of it. So we had to take the 21 devices that we bought and we sent them to Columbia, where a university in Columbia in their laboratory has done the analysis both on the liquids that were bought, but then also on the vapor, right? And so that's what we're analyzing right now with our chemists on what can we understand about what was in those. Obviously, all of these were bought on an illegal market, so we recognize that there will be adulterants or substitutes. So when we were looking at the surveys that we did, we had, for the snapshot of what the illegal market in Mexico looks like, we had 405 people that responded. 80% identified it as male and 20% as female. This is probably pretty close to what the market looks like. 68% were between the ages of 30 and 59 years of age. So they were, old enough to be using these products. More than 97% of those that responded reported having smoked before using these alternative products, and 80% say that they no longer smoke traditional cigarettes. So it would only be about 20% that are still smoking, and about 13% that smoke and that vape at the same time. Most people learned about e-cigs or vapes through friends or people they knew or social media. So they really were searching out for an alternative to their smoking habits. The majority acquire their devices from a physical store, and the rest buy online with delivery to their home. So this is also about reducing the risk of going to a store where you can be seen and where it's actually illegal to be commercializing. But obviously, illegality marks this market. So the results include that 99% of the respondents support regulation, 95% don't identify any health problems related to their use of nicotine, but 5% did experience some, including some irritation, cough, and respiratory issues, which this is normal. This is what we should, and this is how we can be working with people to maybe reduce some of these harms. 61% though do recognize that there are health risks associated with the devices. So these are also people, and we should recognize doing an online survey means that people have access to internet, means they even have access to vapes, which is already a certain population. No, it's not the 15 million people who smoke. 99% recognize that prohibition affects them directly, whether because of quality issues or because it forced them to return to traditional cigarettes. And the results from the vendors, we had 24 vendors who responded, which one has to think this was also a risk just to respond to a survey. What you're doing is illegal. The majority have been in this market between 3 and 8 years. 48% acquire products from international sellers and probably illegally import them. 40% from national providers, 10% produce their own, we're not clear on where they're having this, and 3% from personal delivery. So maybe they're just internally. Several physical stores that we visited said they only had online sales, because we visited these stores across Mexico City and bought 21 devices and liquids. The price range was between $4 and $75 for devices and between $1 and $19 for liquids. This is also important because when we are able to do the analysis of the vapors and what was in each device and each liquid, then we're going to be able to compare it with the price point and be able to see, which we assume there will be, a clear correlation between quality and price. Now to kind of finish up with our recommendations, the initiatives, the legislative initiatives that are on the table right now, within the Senate and the House of Deputies is really around increasing taxes, prohibiting online sales, and prohibiting any flavors. We know that this is not going to have any sort of impact on the market. And what we need is a regulation where people can actually have a sense of what they're consuming and where people can buy products that have been overseen their production by the government. We believe from Instituto RIA, the same way we believe about all substances, that these policy reforms should include a broad spectrum of high-quality alternative products, heat and not burn devices, cigarettes and vaporizers, or even snuff. We don't think that banning cigarettes is going to be the answer either. I mean, we work with products such as opium, heroin, and believe that all of these should be regulated and that a broad spectrum of products should be allowed for people who want to use drugs. And that they should have the information they need to be able to make an informed decisions. We should be able to commercialize products in specialized stores where harm reduction information can be provided to users. If you go to a dispensary or a vape store in the United States, you can see information. They're providing that information in those places of how you can reduce the risks to your health. There needs to be dedicated resources to research to permit greater understandings of the possible benefits of alternative products to stop smoking. We recognize that there are many studies that are going on all over the world, and when you're a part of these newsletters, you're hearing them. But in Latin America, there's a dearth of research. This is not happening in our countries. It's happening in very specific countries in the global north, and this is very much a gap that needs to be filled, because we need to be able to understand what are the habits that we have in our countries that are different, what are the cultural practices that exist, what does the lack of rule of law in some places do to impact this market. It's also very important to educate doctors regarding alternatives, whether that's including patches, gum, and therapy, but also what are some of these devices that, if they were regulated by the government, would be able to provide a secondary alternative to using traditional cigarettes. And then at the end of the day, our biggest recommendation, which is, I'm sure, something that's come out in the last in this day of work and that will come out tomorrow, is really this philosophy of harm reduction. It's about meeting people where they're at, not where you want them to be. So the government in Mexico has really done a great disservice to people who use these products, and also people who smoke cigarettes and people who use drugs, in not providing a broad spectrum, in forcing people to go to the illegal market and buy there where you don't know what the quality is, or creating a market where someone who really wants to change their habits and maybe wants to leave behind traditional cigarettes doesn't have a means, because it's outside of their economic resources, to gain these alternatives. So it's really about how would we be offering these as alternatives to people, which we see happening in other countries. And so we continue to work to be able to provide these recommendations to the government, although we're currently in an electoral period, so it seems unlikely that anything is going to happen until the end of next year. But in the meantime, our work as civil society is really about getting information to people so that they can make better choices in their lives, and so that we can really provide them with research that helps them, and also that it's based in evidence. And so we look forward to next year being able to also share some of the analysis around what was in these devices that we bought, and whether it had the risks that we expect, or whether there might have been some surprises there. So thank you very much, Monica, for coordinating this session, and to my co-panelists, and I look forward to the rest of our discussion.